Sudden hearing loss is what we consider an otologic emergency. It's a condition where a patient suddenly loses hearing, usually in one ear. What is ultrastructurally happening in the inner ear is really not known. There are several theories as to why patients develop this. There's the viral theory, where a virus can affect the membranes of the inner ear and cause dysfunction. There's the theory of membrane rupture, where spontaneously, for unknown reasons, the membranes of the inner ear can rupture and cause mixing of the perilymph and the endolymph. The treatment for sudden hearing loss involves steroid treatment. Now, steroids can be given in a number of different ways. You can take them orally, and after digestion, they can circulate to the inner ear and exert their effect. The only downside of that is all the other symptoms that you develop related to steroid use: insomnia, weight gain, etc. A more effective way of delivering steroids to the inner ear is by topically anesthetizing a part of the tympanic membrane and injecting a solution containing steroid into the middle ear, and then having the steroid passively diffuse through the round window membrane to exert its effect on the inner ear. An even more effective way of getting steroid to the inner ear involves a surgical procedure that takes about 40 minutes. This procedure involves surgery through the ear canal, where the tympanic membrane is lifted and access is gained directly to the round window membrane. Here, an absorbable sponge containing Decadron is placed and implanted into the round window niche. This is the most powerful way of getting steroid to the inner ear. One may ask, why is it important to get steroid to the inner ear in sudden hearing loss? Well, we know that there is an inflammatory response that occurs in the inner ear with sudden hearing loss, regardless of the etiology or cause. Whether it's viral or whether it's a membrane rupture, inflammation does set in. The end products of inflammation can be quite destructive to the inner ear. So steroids basically are monitoring and modulating and decreasing the effects that the immune system has on the inner ear. And thereby, it allows the inner ear to heal on its own. Steroid treatment must be done as soon as the sudden hearing loss develops. We consider this an emergency, and the patients must seek attention as soon as they are able.